Hello everyone, so for this particular slide we are going to be discussing athletic exercise and work settings specifically for an athletic training clinic on a collegiate campus administering to the sports of motocross, surfing, and wrestling. An athletic trainer's career revolves around maintaining the health of any athlete on any given field, regardless if it's football, basketball, surfing, motocross, or wrestling. This is because the athlete's overall goal and focus is to increase their strength, neuromuscular efficiency, endurance, and performance. So the athletic trainer needs to professionally maintain the athlete in any field of health. And when we mean by field of health, we mean physical, emotional, mental, and spiritual. If any of these fields are damaged, this can lead into the athlete performing badly in practices as well as meets or games, which can damage their career, but more importantly, cause physical damage to them. This also means that the athletic trainer must be flexible in their work setting. For example, if motocross racer Chad Reed were to go to Florida for a race for a weekend or practices, the athletic trainer is required to follow him, as well as other athletic trainers for any athlete or for any team that they may work for. A quote from the National Athletic Training Association states about 27% of athletic trainers work with students, while 19% of athletic trainers work at a college or university. What they mean by students is they mean public or secondary schools, but athletic trainers can also be found working in clinics, hospitals, or even in the military. Liaison International goes in depth about the roles of an athletic trainer, which include healthcare administration and professional responsibility, illness and injury prevention, as well as wellness promotion, immediate and emergency care, therapeutic intervention, evaluations, assessments, and diagnoses. When working in an athletic healthcare system, the individuals involved are usually students and athletic trainers. And in an athletic training clinic, there will only be athletic trainers and students, aside from the occasional visit from the team doctors, dentists, and other individuals in the team due to injury. This keeps the focus solely on the student or student athlete. And the importance and benefits of this work setting is to include an area of rehabilitation and treatment, as well as prophylactic responses to prevent injury.
Now moving on to the organization and administration of our healthcare program. In our athletic training clinic, we will include personnel such as the dean of the school, athletic administrators, physicians, athletic trainers, coaches, strength and conditioning coaches, and possibly psychologists and nutritionists as well. We will adhere to the secondary school student athletes Bill of Rights, which include a well-trained coach and staff, pre-participation exams, appropriate playing surfaces, proper equipment, hydration procedures, an emergency action plan, privacy of health information, no playing through pain, immediate injury assessment, and the latest information on the benefits or risks involved in playing a sport. Now moving on to the policies we will implement in our clinic. Those will include that cleats or dirty shoes will not be tolerated, game and practice equipment will be left outside the clinic, there will be no shoes allowed on the treatment tables, non-emergent athletes must shower before treatment, profanity and roughhousing will not be tolerated to any extent, and food and drink other than water will not be allowed in the clinic. We will also include that hygiene and sanitation be maintained throughout the week, that the clinic will be swept, mopped, and disinfected, that equipment will be cleaned daily, Laundry will be washed in a continuous cycle. We will adhere to the guidelines of OSHA regulations. We will develop a budget that includes common supplies like tape, bandages, adhesive foam, braces, splints, heat packs, ice bags, lotions that will be used in treatment, exercise bands, weight balls, foam rollers, AEDs, gloves, pen lights, biohazard bags, heel and lace pads, tape remover, scissors, tape cutters, sterile water, rubbing alcohol, antibiotic ointment, crutches, coolers, water bottles, and towels are some of these that may be included. Now moving on to medical information. Medical records are to be filed in a safe and secure locked cabinet in the office. Emphasis on the transition from paper to digital records. Computer records will be held by a password-protected database in a password-protected computer. Medical staff, athletic administrators, and the dean will all have access to these passwords. This allows access and tracking of previous or current injuries to become more efficient. Providers are able to observe epidemiologies of injuries in sport, population, or demographic, and provides the ability to update treatment logs, inventory, and finances quickly. HIPAA and FERPA restrictions and guidelines will be met.
For the next couple slides, we're going to be discussing legal liability insurance, specifically legal concerns and athletic protection. Before we get into that, we're going to be discussing the definitions of standards and reasonable care, scope of practice, negligence, factors to sue for negligence, nonfeasance, and malfeasance, as well as some examples. So, standards of reasonable care is how a reasonable and prudent person would have performed care. For an athletic trainer, this revolves around how well they were to care for their patient. Specifically, they should be giving their full attention whether the athlete were to have a scrape or to have a fracture. Scope of practice is providing medical service within legal bounds of professional training. An easy example of this would be an athletic trainer would not go to a hospital and perform what a orthopedic surgeon would perform. They need to stay within their scope of practice or their boundaries of their job duties. This is a fine line between negligence and the safety of the athlete. If someone does not follow within their scope of practice, they can cause more bodily damage to the person that they're trying to help. Negligence is defined as the individual fails to render care as responsibly, prudent, and careful. Factors to sue for negligence is defined as duty to act, breach to act, causation, and damage. Nonfeasance is fails to perform legal duty. This can be an example of an athletic trainer neglects the fact that they have an injured athlete. An example of this would be in the wrestling field. If an athletic trainer sees that their wrestler has an injured shoulder or a scrape and they just don't do anything about it, they kind of just turn the other way, that would be declared as nonfeasance. Malfeasance is defined as performs treatment that is not legally theirs to perform. And misfeasance is defined as performs a skill within a scope of practice incorrectly. This can be determined as an athletic trainer wraps a shoulder or an arm fracture wrong if they were to wrap it. Athletic trainers are also responsible for keeping records of treatments, including details of what happened in those treatments, what care was given, who came in, how long they were there, and they're also responsible for keeping those records protected for patient confidentiality. Consent is when the patient understands risks and benefits and makes a voluntary decision. An example in a sports medicine area would be if professional surfer Keely Andrews was injured either in the water or on the sand. Before the athletic trainer can perform that immediate and emergency care, she would need to give consent to that athletic trainer. This also helps that the athlete is in control of themselves and their own body, and the sports medicine team, including the athletic trainer, must understand that before they can give any type of care to the patient or the athlete. Confidentiality considerations, this includes HIPAA laws, patient-directed information, breach of confidentiality, DNR or do not resuscitate orders, as well as advance directives. The confidentiality and consent portion of a sports medicine related field is extremely important and needs to be taken very seriously. It can lead to numerous lawsuits, injury to the athletic trainer or the athlete or the patient. A quote from the Journal of Athletic Training states, "The threat of lawsuits exists for sports medicine professional, whether the athlete is allowed to play or not. In general, established medical malpractice principles govern claims by athletes for injury or death caused by improper treatment or healthcare providers." Another quote by the Journal of Athletic Training discusses the topic about abuse in the sports medicine field. It states that abuse in the sports environment can include physical abuse, neglect, sexual abuse, or emotional or psychological abuse by a coach or other adult, as well as harassment or abuse by peers. Abuse in the sports medicine field is unfortunately not uncommon, and it is crucial for the athletic trainers, coaches, all members of the sports medicine team to know the boundaries when it comes to abuse for the athlete, and it as well as for the athlete to know the same boundaries relating to the sports medicine team. Speaking to a lawyer may protect the athlete as well as the athletic trainer and may give those clear-cut guidelines on what can be determined as abuse and as non-abuse. For the next couple slides, we're going to be discussing recognition of injuries, specifically conditions, dangers, and injuries within a collegiate athletic training clinic setting, as well as tying it into wrestling, motocross, and surfing. Common injuries found in any sport for any athlete can be concussions, heat strokes, abrasions, fractures, and more. Consider different locations for sports of wrestling, motocross, and surfing. There is not one injury that you would see over the other. For example, motocross racers are prone to be getting abrasions due to dirt and rocks that kick up at them. It's the same for a surfer. They can easily fall, hit coral, or scratch themselves on their board. Environmental factors are also a key to injuries for the athlete. This includes weather, altitude, and location. Examples can be if a surfer lives in high altitude, such as Big Bear or Mammoth, and comes down to Huntington Beach to do a surfing competition. If their body is not acclimated enough to the difference in altitude, it is very likely that they will suffer from altitude sickness, which can cause further damage to them. Another example can be a wrestler may suffer from concussions regardless if they are participating in a meet in California or Florida. As an athletic trainer, it is important to be able to recognize the signs and symptoms of specific injuries that an athlete may not be able to physically notice themselves, including concussions, including heat stroke, and altitude sickness. And with that in mind, it is important for an athletic trainer and the sports medicine team to come up with a injury prevention plan or guidelines that they can apply to the athlete during practices and during meets or games. And it is also beneficial for the athletes to take that guideline or plan and apply it to themselves specifically so that they can perform safely. And when we talk about injury, we don't only mean physical, but also mental and emotional injury. A great example of this would be professional wrestler Matt Hamill, who was also a deaf wrestler. He had to overcome mental injuries and emotional injuries when transitioning from wrestling in deaf communities to hearing communities. A quote from the Journal of Athletic Training states that athletic trainers' responsibility to be aware of the health and emotional wellness of the whole individual. This ties in perfectly to the Matt Hamill example, meaning that athletic trainers not only are responsible for the overall health physically of the athlete, but also mentally and emotionally. Another quote from the British Journal of Sports Medicine states pre-participation symptoms causing anxiety are predictors for in-championship health problems. Another example of this would be anxiety and jitters of a motocross racer before they go to race. Motocross racer Ken Roczen has made several statements that after he suffers from great injuries during a race, it takes 2 or 3 races to really get back into that mindset of push, 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 because in the back of his mind, he's still worried about becoming injured again. As an athletic trainer, it is crucial to be able to help the athlete in any given situation, wrestling, motocross, or surfing, and get that mind block out of their mind to help the athlete perform safely. On this slide, we discuss some more examples about mental and emotional injuries as well as some chronic injuries when relating to motocross, wrestling, and surfing. For example, a motocross racer may have concerns with maintenance of reflexes after they suffer from injuries due to previous races. Surfers may have concerns with their overall strength, endurance, and return to the water after injury. Wrestlers may be more concerned with their overall strength, appearance, and function. Some chronic injuries when specifically relating to motocross, wrestling, and surfing. In motocross, it's more likely that you're going to see ACL tears, shoulder dislocations, collarbone breaks, wrist and forearm injuries, as well as ankle and lower leg injuries. In wrestling, it is common to see herpetic lesions, concussions, cauliflower ear, ligament injuries, sprains and strains, prepatellar bursitis, overtraining, skin disease, and impetigo. In surfing, it's more common to see injuries located to the extremities, the shoulder, face, neck, back, and injuries caused by the board. All of these injuries are not solely only going to be found in these particular sports, but these are the most common in each particular sport. And in athletic training clinic, it is important to know and recognize that the athletic training clinic itself, injuries are treated, not the cause of injury. For this slide, we're going to be discussing the definitions of chronic injuries, acute injuries, and environmental conditions. Chronic injuries are defined as fractures, spinal cord injuries, profuse bleeding, blood-borne pathogens, which are more commonly found in wrestling, lacerations, and avulsions. Acute injuries include concussions, sprains and strains, dislocations, overtraining, contusions, and abrasions. Environmental conditions include heat stroke, exertional hyponatremia, heat exhaustion, and exertional cycling. It is important to recognize that the healing process is dependent upon the injury. For acute injuries, the healing process is usually shorter, as a couple days to weeks, while chronic injuries can be months, years, and seasons. And it is also important when tying in motocross, wrestling, and surfing that any of the athletes on either sport can suffer from chronic, acute, and environmental conditions. So, as an athletic trainer, it is important to be able to recognize all of these injuries and how to properly care for them while staying in your scope of practice.
Now moving on to injury prevention methods. In our clinic, we will implement resistance training, plyometrics, and balance training as needed in order to have a fruitful injury prevention program, and these methods should also be used during preseason training programs. This allows us to observe increases in strength, power, proprioception, and neuromuscular control and endurance. Surfing and motocross are individual sports, meaning that athletes themselves should be able to objectively assess their physical, mental, and behavioral well-being in relation to the sport they are participating in. Our staff should focus on whole person health as best practice for helping every aspect of our athletes. Because motocross, surfing, and wrestling are the predominant sports that we are focusing on, our athletic trainers will encourage athletes to be honest with themselves and their skill level. Periodization should also be implemented, which allows the athletes to be at their optimal performance level when in season or competing. PPE should be utilized and is useful but does not limit the athlete's movement. Our athletic trainers should be trained to properly fit equipment, and customized fit equipment should also be utilized because this is the best option in injury prevention. Our athletic training will also focus on nutrition and hydration habits of our athletes. Nutrition provides endurance and fuel for the body, while hydration maintains internal body functions including the immune system, organ function, body temperature, and regulation are some of these. Dietary recommendations say that the diet should consist of 45 to 65% carbohydrates, 20 to 35% fats, and 10 to 35% protein. However, this also depends on the sport our athletes are practicing in. Endurance athletes typically consume a higher amount of carbohydrates and a fewer percent of fats, while strength and power athletes consume a higher amount of protein and a fewer amount of carbohydrates. We will also enforce the consumption of the proper amount of micronutrients, including vitamins, minerals, and electrolytes.
So when it comes to athletic training clinic in a school, it's important to remember that our sport particularly is focusing on motocross, wrestling, and surfing, and each of those has its own different challenge to the skill of the athletic trainer. So when it comes to athletic training of motocross, motocross has particularly specific athletic training challenges since it is not a common collegiate sport. It's performed in January through August, and the preseason, the months before, is the time for the athletic trainers to focus on encouraging the athletes to increase their strength and endurance while following a specific training program in this preseason time. Some important things for the athletic trainer to encourage include increased physical strength, endurance, reaction time through neuromuscular efficiency, balance, and coordination. Functional core movements such as squatting movements allow the athletes to brace properly when performing jumps and tricks. So some common injuries of this sport include ACL tears, shoulder dislocations, collarbone breaks, wrist forearm injuries, and ankle and lower leg injuries. ACL tears are most common from twisting of the knee when the foot is placed on the ground while the bike is speeding. Shoulder dislocations, collarbone breaks, hyperflexion, hyperextension of your wrist, and pronation, supination, plantar flexion, or dorsiflexion beyond the normal range of any of the joints are also caused by improper landing. So in this case, some protective equipment that could be encouraged by athletic trainers for the athletes to wear when fitted and all that sort of stuff in the athletic training clinic should include knee braces, shoulder braces, wrist braces, as well as taping for each of the joints. The role of the athletic trainer isn't to just treat the injury, but prevent it. So the athletic trainer should also encourage them to have an intensive training program consisting of strength training, endurance training, resistance training, as well as focusing on increasing neuromuscular efficiency through balance, mobility, and stability training, as well as real-life exercises through dynamic training. Some examples of this would be including balance exercises on a Bosu ball, balance boards, doing yoga, stretching, doing some CrossFit sort of exercises, Olympic training possibly, and the like. So some rehab exercises that the athletic trainer would probably likely do within the actual athletic training clinic include soft tissue massage therapy, which is basically using your hands to manipulate the muscles and knots in their muscle, cryotherapy, which is using things such as ice on the skin to reduce knots and decrease heat in the muscle, and stimulation therapy, which is applying electricity through the muscle, contracting it, and releasing tension in the knots. Another sport that is covered by our athletic training clinic on a collegiate campus is wrestling. The sport wrestling runs November-ish to March, and the pre-training season in between. The athletic trainers must ensure that they provide the care and exercises needed to prepare wrestlers adequately for their competitions. Since it is a high-risk sport, weight classes must also be considered as well, and the skills are especially needed for performing this sport correctly. These skills include footwork technique, hand-eye coordination, endurance, speed, flexibility, agility, balance, and mental strength, all of which have the ability of being improved under the guidance of the athletic trainer. Some injuries that may result aren't just physical soft tissue and skeletal injuries, although those are the majority of injuries that wrestlers face. Other injuries may include ringworm, herpetic lesions, concussions, cauliflower ear, ligament injuries, sprains or strains, prepatellar bursitis, overtraining, skin diseases, and impetigo. When it comes to concussions, those tend to occur from a mild blow to the head, whereas fractures occur from simple, compound, incomplete, or complete fractures. Ligament injuries such as ACL tears are the most common, with half of wrestlers injured each season. The athletic trainers are obviously very busy with each of the sports since they all tend to be pretty high risk with a variety of injuries consistently happening. Most of the athletic trainer's work is going to be attending to the athlete's injuries rather than instituting preventative measures, just because half the athletes that come in are going to be injured rather than seeking out preventative measures. Those should already be in place for the most part. So injury prevention measures themselves, though, tend to consist of a sports medicine team being present as well as the athletic trainer themselves at games and practices, correct rehab, proper cleanliness of equipment, annual physicals, annual drug testing, proper technique throughout the entire process of training and in the performance of competitions, proper hygiene, and trained and knowledgeable coaches and staff such as athletic trainers and the whole medicine sports team during practices and matches. So along with the sports wrestling and motocross, our collegiate athletic training clinic covers surfing. Surfing tends to be a safe sport with a low risk of injury. Skills for surfing tend to include the knowledge of the sport itself, being aware of etiquette in the water, using proper gear and discernment, having a proper warm-up and training routine, as well as using skills and techniques that apply directly to the moves that they need to adequately perform in the water. Injuries tend to be located on the head, face, leg, back, shoulder, or arm, and tend to be the result of contact with one's own board. Some of the unique factors specifically related with athletes being at risk for injury in the water are wave power, sea floor itself, sand, cervical trauma, rip currents that might pull them out or force them off their board, drowning, overcrowdedness, lack of preparation, short boards, and entanglement with the loop. Injury prevention techniques that the athletic trainer can encourage include instruction to paddle properly and efficiently, insisting that they perform a warm-up each time before heading out in the water, encourage stretching, hydration, the application of sunscreen, as well as obeying warning signs and etiquette of other surface and swimmers in the water, using surfing equipment and protective gear, following a proper fitness program, changing up the board design for safety measures, and proper breathing and a functional movement pattern. In particular, the athletic trainer might prescribe specific exercises to increase the surfer's endurance, strength, flexibility, balance, and power, their ability to avoid muscle overuse, and encourage reduced rotation of the knees, the activation of upper body muscles, the use of major muscle groups, and engaging in proper static and dynamic stretching, as well as strengthening the rotator cuff. As healthcare professionals, we are sent to serve. Jesus said in Galatians 5:13, "For you were called to freedom, brothers. Only do not use your freedom as an opportunity for the flesh, but through love to serve one another." Much more joy comes from serving others than could ever come from fulfilling our own selfish desires. This is just what Jesus said in Mark 10:45, "For even the Son of Man came not to be served, but to serve, and to give his life as a ransom for many." Often many who work in healthcare tend to do it for the status, the money, the position, the way others look at them. However, God calls us to serve him not for the love of money. No one can serve two masters, for either he will hate the one and love the other, or he will be devoted to the one and despise the other. You cannot serve God and money. Matthew 6:24. Jesus went through extensive measures to make himself an example for how we should serve others. He washed the disciples' feet. He healed those in need. He spoke to those who would listen. He went out of his way many times to help those who were sick. And it showed, ultimately, how big his love was for us. We should, as healthcare providers, be able to reflect that love in the workplace and reflect the light of Jesus and direct the glory to him. As healthcare providers, our place is not to take the glory for ourselves. Our goal in life is not to satisfy ourselves. Our goal is that each client we have is an opportunity for God to work through us, using us to bring him glory while healing and showing the light of himself through us. In 1 Corinthians 4:1-2, it says, "This is how one should regard us, as servants of Christ and stewards of the mysteries of God. Moreover, it is required of stewards that they be found trustworthy." As students who pursue working in healthcare, we have the great opportunity to reflect him and show Christ's love to those around us by doing what we do and helping others to see the light that shines through us and the glory that we give to him.